Good morning. Happy Friday to you from wherever you are in the city, at work, in the
At
office,
home.
at home, everywhere you are at this moment. We just want to welcome you to having a coffee with Dr. Munné. We are having a great morning so far, and we are ready to continue learning about our dental health. So today we are going to talk about gum disease, and Dr. Munez is going to give you some slides where she's going to introduce more about this topic. So let's get right in. Thank you, Dr. Munez, for another Friday.
Oh, absolutely. Thank you, Adrian, and good morning, everyone. I hope that you're ready for today's topic because we have been approaching different topics. We talked about implants, we talked about gum recession. I think it's time to talk about periodontal disease because it's still in 2026. We still have a lot of untreated periodontal disease. And I would like to, first of all, just make you all aware of what it is and what you should be looking at. And also, maybe we can explore a little bit like what are the reasons, right, that patients do not want to treat it, or maybe they don't know. So let's just go ahead and start looking at a case. And I think that, we're all visual individuals, right? So it helps a lot to have something. So I'm going to put some slides here. And right
Right
now,
now,
you
you
guys
guys
are
are
seeing on
seeing on
your
your
screen.
screen,
And,
and
there might
there
be
might be
that
that
some
some
platforms like
platforms like
TikTok or
TikTok or
somebody
something,
that
but
might
that
not
might
be
not
able
be
to
able to
see
see
everything, but
everything. But
just
just
refer to
refer
the
to the
video
video
later
later
on,
on,
who's going
who's
to be
going to be
posted on
posted on
YouTube.
YouTube.
Actually, they
So,
are,
So,
Dr. Munez.
yeah,
yeah,
they
they
are.
are.
Yes, now
Yeah.
TikTok
TikTok
and
and
Instagram
Instagram
viewers,
viewers,
they are
they are
able
able
to
to
see
see
what is
what is
happening with
Thank
happening
the
with the
you.
slides. So
slides. So
that is
that
an
is an
amazing.
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 Well,
Well,
thank you,
thank you,
Adrian.
Adrian.
He's
He's
like
like
the
the
tech
tech
guy
guy
here
here
that's
that's
making
making
everything
everything
possible.
possible.
So
So
I
I
appreciate
appreciate
that.
that.
So let's
So
look
let's
at
look
this
at this
case. This
case.
is a
It's a
case
case
of
of
gum
gum
disease
disease
where
where
we're
we're
having,
having,
we can
we
see
can
that
see
there's
that
a
there's a
lot of
lot of
inflammation. The
inflammation. The
teeth
teeth
look
look
longer. We
longer. We
see
see
some
some
teeth
teeth
have
have
actually
actually
come
come
out a
out a
little bit,
little
like
bit, like
they
they
have
have
come out
come
of
out
the
of the
bone.
bone.
There's
There's
definitely a
definitely a
lot of
lot of
stain,
stain,
a
a
lot
lot
of
of
a lot
a
of
lot of
stain. You
stain. You
can
can
see
see
that
that
there's
there's
also
also
plaque.
plaque.
There's
There's
inflammation. The
inflammation. The
gums look
gums look
very
very
bulky.
bulky.
The
The
patient had
patient had
already
already
lost a
lost a
couple of
couple of
teeth
teeth
that
that
came
came
out.
out.
So, so why there's still so much disease in 2026 when we have AI and we're building robots, but
Yeah.
we're still as humans we have so much. So I think that number one probably is like we need to educate patients. We need to educate patients on that. Periodontal disease really doesn't hurt. So a lot of times it goes very silent, and the patient does not know that there's anything wrong until later on. And sometimes when the patient realizes that there's something wrong, it is way too advanced. Periodontal disease sometimes does not give any signs other than maybe some bleeding gums and maybe a little bit of sensitivity to cold or even sweets, and on the initial stages. But by the time that the patient really has severe symptoms, the teeth are very loose, and
It's already
sometimes
kind of
there's,
late.
yeah, well, it's never late because we can always do something. And then we do have other options like, implant dentures.
Right.
But let's try to see if we can prevent that you guys get to that point, right? Because we're here to make sure that you guys can have a healthy, fruitful life. And in order to be healthy, we need to start in the gums, right? A lot of diseases, a lot of problems we don't know, but they're started and they're originated in the mouth. So I want to make sure that you all understand the importance of having regular checkups, regular cups. And I think the fear of pain, having discomfort or going to the dentist and experiencing like that the dentist hurts you, right? Or that, that the treatment is going to be painful. I think that already deters a lot of patients
Yeah.
from moving forward. And I would like to actually help you just kind of replace that myth with the fact that today Dentistry is very comfortable. We do have wonderful medications, anesthetics, topicals that prevent that you even feel the first initial, puncture when you start numbing you. So you need to have like a good dentist, and a good dentist is not gonna hurt you when you get numbing, and you're going to make sure that you're comfortable throughout all the treatment. In our office, we make sure that everything is pain free, so that's our
That's amazing.
mojo, right? So everything has to be comfortable for our patients, so patients can make it through it, right? So I have to make it doable for the patient. Otherwise, who wants pain? I mean, I don't like pain either, right? You
No,
don't
not
like
at
pain
all.
either. Nobody likes pain. So we want to make sure that you're going to be comfortable. So destroying the myth of going to the dentist is going to be painful, I think that's important. But also, we might feel like, oh, well, I don't have any pain, everything is fine. But maybe not everything's fine, because there's a lot of things that advance silently. And then when we realize is a lot, and then that drives the treatment needs up, and that's going to get the estimate up. So the sooner that you can start already, like checking yourselves, having your kids from the beginning, take them to the pediatric dentist or your general dentist, have them check and have cleanings regularly. And your regular cleanings are going to be your best friends. But I want to walk you through like what happens on a case, right? So when we have a patient coming, let's say, with periodontal disease, and I think that now the image is back on, that there's a lot of, inflammation, and there's a lot of, you see a stain. Of course, the patient has not been in the dentist for many, many years, and there's a stain. Tartar, plaque, which is the soft deposit, a lot of inflammation, a lot of swelling. There's a lot of pus, abscesses. So pus is coming every time we touch the gums. So see here in the front, every time we touch, there's a lot of pus. So that will help the patient walk through their barriers and making sure that we can, go ahead and they can understand what we need to do. So here you have, like what we call the periodontal chart. I know that's like a mouthful of words, but what it
Mhm.
means is that we're going to be charting, we're going to be measuring, and we take 6 measurements per tooth. So each tooth, you can see here in the top 2 rows are the upper teeth, and the top row is like the measurements that we have on the cheek side. The bottom row are the measurements that we have on the palate side, on the tongue side. And the same thing happens on the bottom. The measurements on the very bottom are the bottom teeth on the cheek side, and the ones in the middle, a little bit a row up, are going to be the measurements that we take on the tongue side, on the lingual side. And just imagine that the tongue is like this line in between the upper and the lower. The red dots signify the bleeding, and there's also some blue dots. You can see here like some kind of green dot. That means that there's pus coming out. So there's a lot of information that this chart gives us. It gives us the teeth. You can see that this tooth does not have measurements. That's because it's inside the bone. We do see how deep are the measurements. And of course, that's the measurements that we take the first day. So they're just indicative, but sometimes the patient is very tender. So we have to be careful that we don't hurt the patient while we do that. But the measurement might not be accurate. So what we do is that once the patient is numb, then we go ahead and we do a new chart, so we make sure that we get more accurate measurements. We can see that there's a lot of red bars. The red bar signifies how deep is the bone loss. So if you look at, for instance, this tooth here on your upper left side, that is a molar. That's the big tooth. It has 3 roots on the top, and you can see that that bar is actually quite deep, quite long. So that means that our measurement went all the way until it touched the gum, where the gum attaches to the tooth. So that means that that patient had lost all that bone, maybe even more, right? Because there's definitely a lot of inflammation here. It could be that the attachment of the gum is actually even a little higher. But look at the advanced stage, of this bone loss. And then when we want to correlate that, I think that if I do this, okay, so you can see that with the x-rays. So you observe the bone is this grainy, like a light gray area, and you see that there's only like a very little amount of tooth that's hold up on the bone. And this tooth here, that was like the front tooth of the patient, actually has no bone around. So there's like a lot of bone loss. And the same thing is happening on the bottom teeth, where we see that there's barely any bone. And if we go back to the original photos, you see that those teeth had actually come out, as well as this tooth here is also coming out. That's because there's really no bone holding the teeth, and the tooth comes out. But even a situation like that, we can turn around, and definitely we can save, a lot of the teeth. There's different options and different ways, and we always like to give different options to the patients. So we're going to talk about the implant denture. We're going to talk about, regenerating bone. We're going to talk about different options, laser surgery, LANAP, things like that. So, for you that might maybe suspect that I have something like that going on, maybe not so much, but maybe you have a little sensitivity to cold, I would urge you to go see a dentist and have them examine you, and just see if maybe you do have some gum issues. Not all the sensitivity is due to tooth decay. Some of it might actually be responsible, the periodontal disease of that sensitivity. So I hope that this has given you some information, enlighten you up, and give you education, and make sure that we can save some more teeth. And maybe you can, or bring a family member if you think that they might be experiencing some of that, so we can help them.
Yes, thank you so much, Dr. Munné, for showing us. This is actually very clear, as you can, what are the approaches you can take, the actions, and so it can definitely so important. Thank you for showing that, Dr.
Thank
Munné.
you.
And thank you guys for tuning in another Friday. Do not forget to like us, follow us on Facebook, TikTok, Instagram, and YouTube. We're everywhere. So you will have more of this reels and stories with this important information, where you can have and share with your family, friends, and everybody that can, that needs help on this. Thank you so much. Please do not forget to like us. We'll see you next Friday. And just remember that you take care of your teeth, and that's the most essential thing. We'll see you around.